So here it is, Dr. Rosemary in the afternoon, and it's such a pleasure to have Dr. Rosemary help us with teeth. You know, it's not something that it's probably not a dinner party discussion, teeth. So Dr. Rosemary is going to give us what we can talk about at our dinner party and what will help each other. So hello, Dr. Rosemary.
Hello, Anita. How are you this afternoon?
Oh, I'm great, and I look forward so much to your helping our listeners know how to take care of their teeth better, especially if they have teeth. If they don't, we'll talk about that. But let's start off with bad breath, and what are the top foods to prevent bad breath? And, I like onions, but I don't know, or garlic. So what do I do about that?
Well, before we get into the foods to prevent bad breath, Anita, why don't we talk about what bad breath comes from?
Okay.
Bad breath can come from oral hygiene and gastrointestinal health. What this means is that the breath odors originate not just inside of your mouth, but also from your digestive tract, which is your stomach, your intestines. So that's where the odors can actually come from. So the culprit and what is causing the bad breath is bacteria. So the doctors will tell you that if you have bad breath, first you should make sure that you're eating right, meaning that you should get an entire balanced diet of, proteins, carbohydrates, lots of fruits and vegetables, and plenty of fluids to keep your gastrointestinal tract moving.
So what is it that is actually causing the smell?
It's the bacteria.
Ah.
It is the bacteria. Now, that's why sometimes people that they have reflux, they can have acid reflux that actually is, like regurgitation, and they can get a bad breath from that. What is that? That's actually the bacteria that's in their stomach. They have H. pylori. You've heard of H. pylori.
I have.
I'm sure a lot of your listeners have. That can cause bad breath. And that what is H. pylori? It's a bacteria.
Okay, so now...
I'm sorry. So brushing and flossing after every meal can help, okay? But then sometimes that still may not solve the problem. You still may have this offensive breath. So then you have to look a little bit further sometimes. Once you go to a dentist, and your dentist rules out and says, and I have a lot of patients like this, they may come to me and they may say, well, I have this very foul odor in my mouth. I'm brushing, I'm flossing, and they may come, get a regular checkup, get a cleaning. They may have no cavities. And at that point, if they are still having this offensive odor, at that point, then I would send them to a medical doctor and say, you need to now go and get your stomach checked out. And a lot of times, they may have some digestive issues which may never have been diagnosed because it will be coming from the GI tract, the gastrointestinal tract.
So when a patient comes in and they sit down for the first time in your dental chair, can you pretty much know what it's coming from?
Well, the first thing, I assess their mouth. If I see that they have a lot of plaque buildup or a lot of tartar buildup, then I would first say that it's coming from the mouth because plaque and tartar is going to contribute to all the bacteria. That is a form of bacteria. Once we remove all that plaque and tartar, and if they have any decay or any rotten teeth, and we resolve all of those issues in their mouth, then that may more than likely take care of the bad odor in their mouth. If they still are having bad odor after all of their dental issues are resolved, then it's more than likely a stomach issue.
That's interesting. So, it's funny. I just thought about this, Rosemary. Years ago, when I was a little girl, I had a grandfather whom I really loved, but I hated to get near him because he had this funny smell. Now, do you know that that's still there in my brain, and every once in a while, I go somewhere and I smell that smell on someone. So it's a very strange smell. It's not really a terrible smell, but it's a certain smell that's there. And isn't that funny? It's impregnated in my brain.
Yes, that is funny. And I'm going to tell you now that we've established where the odors can come from, I'm now going to tell you about some foods that can prevent bad breath.
Okay.
Everyone's heard about parsley. Chewing on parsley can help, solve the bad breath. But also, did you know that coriander, spearmint, eucalyptus, rosemary,
All right.
and cardamom. These are all good herbs that you can use to fight bad breath. You can use them either to chew on them, or also you can make by steeping them in hot water. You can also make a tea. And these are all good for bad breath.
That's that. Now, see, I grow rosemary and I grow parsley in my greenhouse window, but I never would have thought to use it as a tea. But that's a very good point. So now this coriander is that's also. But these are things we cook with.
Yeah, these are things that you cook with every day. But instead of using them in the cooked form, of course, you would use them fresh, like parsley. You know, when you eat garlic, they say, parsley will get rid of the breath, the bad odor. So usually we take parsley leaves, and you can chew on the parsley leaves, and that can help that.
Okay, so if someone has bad breath caused by whatever it is, and you will help them, but we need to know at least what we're doing. So let's say that we go out to an Italian restaurant and we have a lot of onions and garlic. We should ask for parsley, I have to assume. I'm sure they'll have some and say, could I have some parsley?
Right, exactly. You can ask for some parsley leaves and just start chewing on the parsley leaves, and that will help it. Also, you can, by having a serving of yogurt every day, that will reduce the level of odor-causing hydrogen sulfide in the mouth. Now, hydrogen sulfide is one of the gases that we have in our mouth that causes the odor. Also, it cuts back on the bacteria in the mouth. So having now the yogurt you have to have has to have live culture in it. It has to be one of the either active culture yogurts, but these yogurts will also help reduce the amount of bacteria in your mouth.
So is that the Greek yogurt? Is that active?
The Greek yogurt, I believe, has active culture in it. Activia, of course, has active culture. And there's many. The Dannon one has live culture in it. It says live culture on it.
Oh, okay. So it says live culture.
It says live or active culture on it.
Well, that's great. So we know that we need to have that. It's good for us anyway. You put some fruit in with that. It's lovely.
Right. Exactly. Now, also, having crunchy fruits and vegetables like apples, carrots, celery, any kind of fiber-rich fruit or vegetable is good when it comes to fighting halitosis or bad breath.
Is that because it's scraping the teeth
because
as you're
what
chewing
this does is these foods, and this is what we spoke about last week, this increases the saliva production, and it keeps your mouth moist and rinsed out. And a lot of times, carbohydrates and proteins, they get stuck in between your teeth. Even like healthy foods, like whole grain cereals, whole grain bread, chicken breast. So what happens is, think about it. If you eat a chicken breast, and then for dessert, instead of having that delicious cheesecake, you follow with maybe a Granny Smith apple, a crunchy apple. That apple is going to go, and it's going to cleanse in between your teeth.
So there really was a reason why an apple a day keeps the doctor
away. Exactly. It's also for the vitamin C and the vitamin A and everything else. But that's why you want to try to, crunch on one of these things, an apple, a carrot, all of these things, because they are good for your teeth. But I always tell my patients, don't bite on them with your front teeth, bite on them with your back teeth.
True. Yeah,
because when you bite on an apple with your front teeth, unless, you have like strong horse's teeth, you're really going to break your teeth. I always tell my patients, always cut it and bite with your back teeth.
Good, thank you. And I want everyone to know you're listening to Rosemary. It's in the afternoon, and she is a dentist, and she has an office at Adult and Geriatric Dental Center. Actually, it's the Adult and Geriatric Medical Center, and she has her office up there, which is the dental department. And she's located over there on East Commercial Boulevard. And what you can do is you can call for an appointment. You can have a free consultation. And then, of course, once you meet her, you're going to love her just like you are on the radio. And you're going to just want to do whatever she thinks that you should have done. Her phone number there is 954-489-1345. I'll repeat that. It's 954-489-1345. Make sure that you call for an appointment, and you'll be very, very happy. Well, Dr. Rosemary.
And there's one more tip I have. One more tip.
Good.
You also want to eat berries, citrus fruits, melons, other high vitamin C rich fruits, because what they also do, that creates an environment that the bacteria does not like. So a diet that's rich in vitamin C, that's something that the bacteria can't really survive in.
Oh, well, now, that's funny that I know that it's good for you, but I didn't know that I didn't know that it can't survive in that.
Yeah, yes, and it also is good for preventing gum disease and gingivitis. So think about it, because gingivitis is caused by plaque and bacteria. So if the bacteria cannot survive in an environment with vitamin C, right, then you won't have gingivitis.
That makes sense. That's
so
good.
That's the reason why. So you want to have these types of fruits. Well, right now you're doing great because you're having juice because you don't feel too well.
Right.
So you want to have high amounts of vitamin C.
Right.
And then you won't have the bacteria. If you don't have the bacteria and with good oral hygiene, you won't have all this plaque buildup, and thus you cannot possibly get gingivitis or periodontal disease.
Well, that's that's a lot of good information. That's a lot of information. In fact, I'm going to ask all our listeners that you need to get yourself a little notebook and you can put on the front Dr. Rosemary in the afternoon, because over the next many months you're going to get a lot of information on good dental care. And what we've just heard today, talking about how to prevent bad breath and what to take to not what you can do after you do have bad breath, eating parsley and rosemary and having your serving of yogurt, how to have your apples and your other vegetables. And it's very important that you write these things down. You're going to be much smarter after Dr. Rosemary finishes with all of us, because when you think about the intestinal,
the GI, and that's
the GI series. So,
right.
So in other words, it really is so much more than just teeth. I always thought that it really, you just didn't have your teeth cleaned or something was wrong there. But you're telling me it really does come from a physical problem.
Absolutely, absolutely.
Well, okay, and you, of course, have medical doctors. You have Dr. Mencia there and other people who can really help someone if they do have a problem.
We have a neurologist here, podiatrist here. We have really all different specialties here, so it's very convenient for the patient. So they don't have to go to several offices to see different doctors. In one medical center, they have the convenience of seeing whatever doctors they may need to see.
Right. It's a great idea. I really love when I come there and I see that. Let's talk about something and I thought that it would also cause bad breath, root canal. If you need a root canal, how do you know you need a root canal? You have a pain in your tooth?
More than likely, you're going to know because you're going to have pain, you're going to have sensitivity to hot and cold, and you're going to have sensitivity when you bite on your tooth. When you go to the dentist is going to take an x-ray, and they're going to see the pulp or the center of the tooth. That's inside the center of the tooth is something called the pulp chamber. That travels right down the center of the tooth, and in there is something where the nerve is. The nerve is what gives the tooth life, basically. And it's what gives you sensitivity to hot, to cold, to everything, feeling in the tooth. You may have decay that is going into that pulp, into that nerve, and that's what's causing all of this sensitivity that you're having. The tooth can have anywhere between 1 and 4 canals. It depends on which tooth it is, whether it's a front tooth, an anterior tooth, or all the way to the back to a molar. So depending on which tooth it is will depend on how many canals it has. So when you go to the dentist will determine that you need a root canal. And then they will, tell you that what you need to have done. When the treatment, I will go over what some of the reasons are for needing root canals. But when you have a root canal, the actual treatment of having a root canal is basically the root canal can be performed in 1 visit or 2 or 3 visits. Basically, with the procedure, the first thing is, of course, you're numbed up quite thoroughly. Then afterwards, the dentist will, excavate or clean out all of the decay, will go into the pulp chamber or into where the nerve is, and he or she will clean out where the nerve is. Will clean out the nerve. It sounds quite painful, but with today's techniques, the patients are so numb that they really don't feel anything. And when I tell my patients, Anita, about root canals have gotten such a bad reputation. Also, because of the through the media, and when there's on the movies, when you see something about a root canal, they always portray it as something so painful. So, whenever you tell somebody about a root canal, all of a sudden they feel, oh no, I need a root canal. But really, it's not so traumatic because you're so well anesthetized that the patient really doesn't feel anything.
Well, let me go back a little bit with you, Dr. Rosemary.
Yeah.
Now, in order to avoid a root canal, what should someone be doing? I mean, what if they took care of their teeth, or is it a beginning? Is it a cavity that first starts?
Yes. It's a cavity. It's tooth decay, basically, that invades the tooth, and it goes through the enamel, and then it goes into the pulp. So that's why you need a root canal. So what the person should be doing is, if you have a small cavity, you should be treating it. If patients say sometimes, oh, it's a small cavity, it doesn't bother me or whatnot, when they leave it, it will progressively get larger and larger and larger. Or trauma sometimes. Sometimes they have a little chip on a tooth, and sometimes they leave the chip. But that chip sometimes can get worse and worse and worse. So you want to really be sure you treat everything that's in your mouth, because that's how things lead to progress to root canal.
I see. Well, that's a very good point then. So we know that if we haven't taken care of our teeth properly, and if you go to Dr. Rosemary, she's going to make sure that she does take care of your teeth properly. You don't have to have these if you do what she asks you to do. But if you didn't, and before you even got there, and you had to have a root canal, she's explaining what that happens. Now, how that happens. So when you go home with a root canal, are you going to have, pain, and are you going to be swollen?
Oh, you may be sore, for a day or two, but, we give the patients pain medication. If they need antibiotics, we'll give them antibiotics. Swelling, you will not have swelling, but we will give the patients, whatever they need to have so they're not uncomfortable. But like I said, the most important thing for the listeners to understand is that we really make sure that the patients are comfortable so they don't feel anything during a root canal. They really shouldn't. If they feel anything, it should be very temporary. It should be, maybe while they're being anesthetized or something to that effect. But nobody should be in pain during a root canal. If the tooth's infected, which it can be, and that's why they need a root canal, they should be given antibiotics first for the swelling to go down, and then they get the root canal. It's hard. If you treat an infected tooth for a root canal, that naturally is going to be painful.
Oh, so they may come and you may want to then send them home with antibiotic, and then when it gets better, then they would come back.
Exactly.
Well, that's a good point for people to know. I mean, I hope you will go to Dr. Rosemary, but if for some reason you're at another dentist, realize that you say, no. First, let me get this cleared up, because you never know.
Right.
Yeah, well, that's a very good point to talk about that. So root canals are, now you said at one point, I asked you, do you do all root canals? And you said not really.
Well, some root canals we don't do, because if the nerve is, the canals are twisted or they have a curve at the end, that I would send to an endodontist. So, if it's a straightforward root canal, it seems like something that is not complicated, then I'll do them in my office. But if it's something that is best treated in the hands of a specialist, that I would send to a specialist.
That's very fair. Yep, that's a good thing. So you're being, very cautious, and I think that's you're being prudent with your patients.
Always.
One thing we haven't discussed, and I know that you know so much about it, but I want to ask you about X-rays. So now, when someone comes in, what are X-rays all about? What do you see? Why are they good? Are they necessary?
Well, X-rays are necessary because it's the only way we can really see inside the tooth. We can see clinically the surface of the tooth. We can see clinically the gums. But the only way we can see the level of the bone, what's going on in between the teeth, what's going on inside the tooth, the nerve, is through X-rays. So X-rays are important. We use digital X-rays in our office. And I recommend to my patients when they come in that they do get x-rays. We take x-rays on our patients once a year, more often if necessary. So if a patient comes in, they have pain or they have a broken tooth, we will take an x-ray of that tooth. But it is important to take an x-ray because otherwise, if they have periodontal disease where they have bone loss, we would never see that. If they have decay, we would never see that. So things like that, x-rays are important. There's no other way to be diagnostic and to do a thorough clinical exam on a patient without x-rays.
That's good. I'm glad you cleared that up because I've heard people say, oh, every time I go to the dentist, he or she wants to do x-rays, and that's just a blah, blah, they always say that. But I always feel that it's the way for someone to be able, just as you said, to see what's really going on.
Yeah, it is very important. I mean, you don't need to have them every 3 months, but if there's any changes, anything that people feel, sometimes they're having discomfort, pain, something, then we do like to take them because it's the only way. And with the digital x-rays, there's really little or no radiation, so there's no danger to the patient. There's no reason not to take them.
All right. Well, that's something I know we've not covered, but I know that that's a very important point for somebody. Now, if someone is coming to you for the first time, should they ask for their x-rays, or you want to just take new ones?
I'll take new ones. And I tell my patients this, I don't need their x-rays from the old dentist because if I take new x-rays, I will see everything that's been done. It's not like going to a medical doctor for the first time where the medical doctor needs to have all of your old records so he or she can see what was done by the previous physician. In a dental office, once we take x-rays in your mouth, I can see everything that was done. There's nothing that I won't be able to see. I can see if you've had silver fillings, if you have white fillings, if you have crowns. Obviously, I won't know how many times fillings were changed, but that is not pertinent to me. What's pertinent to me is what is in your mouth at the time of the visit, so I can move forward from that point. If there is something that looks suspicious and is of question, and if I do need records, I can at that point request them. But for patients to try to go through getting records, it's not necessary.
Okay. Well, this has been some heavy discussion, so I want to do some light things. I want to talk about food because you know so much. You're a great cook, and you do know so much about what's really good for your body. And probably certain things are better for your teeth maybe than other kinds of food. So why don't we have some fun and talk about good nutrition? Okay.
Some of the good things to eat, we touched on already because we said they were good for bad breath, for halitosis. We talked about apples and carrots and celery as far as preventing bad breath, the fiber-rich diet. Those are also very good for nutrition. Another good thing that is very good for your oral health and basically good for your teeth is chicken. You want to eat foods like chicken, fish, foods like that which are high in protein. These are foods that are going to help the mineralization. These are foods that are good for the bone and the enamel of your teeth. Okay? Red meat, things like this, I don't eat it. One way or another, it won't make a really big difference to your oral health. But I don't recommend it so much to my patients. Like I said, I told you this once before, I educate my patients a lot when they come in. And we talk a lot. And we talk much more beyond the scope of dentistry. So we do go on and we talk a lot about diet and good nutrition. So I don't recommend my patients to eat a lot of red meat. So I do recommend them a lot on chicken. I recommend them to eat everything from the 5 food groups. I recommend them to have dairy products, low-fat milk, cheese. Cheese is very, very good. The calcium in cheese, the calcium in yogurt, all of that is very good for the enamel and the bone in your mouth.
I happen to have a craving for eggs, and I try to have a soft-boiled egg every day. How is that?
That's fine. That's good. That's from the food pyramid, and that's fine.
I was just, because people have always worried, too many eggs, but I love
Oh,
no.
You're allowed to have actually I think it's about 8 eggs a week.
Really? Well,
Yeah,
thank you. That made my day today.
Oh yeah, you're really allowed to have a lot of eggs, much more than most people think.
They have a lot of big nutrition in them, don't they?
Yeah, you're allowed to have a lot of eggs, actually.
Good. Okay.
One very important thing is water. Very, very important thing is you really want to make sure you're drinking a lot of water. Because when your mouth is dry, you're more prone to having cavities. And not carbonated beverages, not things like that, but you really want to just drink a lot of water to keep your mouth flush, to have your mouth being, constantly washed, so whatever little food particles you have, things like that, will not stick to your teeth.
Well, that is very smart. And now, do you care if it's water or let's see, sparkling water? Does it matter?
No, that's okay.
Yeah, well, that's good because I actually favor sparkling water, but I didn't know. And I don't drink soda. I've seen people, and I'm sure, talk about cavities, I've seen people with a Coke in their hand all the time.
I know, and it's terrible. It's absolutely terrible. You want to have cereals, and you also want to eat nuts that contain iron. Very important. Iron is very, very important, again, to the mineralization and to enamel. So iron is important. Now, iron, comes from red meat. But I'm not an advocate of red meat. So you have to be careful. You can get iron from spinach. So there's other places of getting iron besides red meat. Because you have to look at the dangers of red meat. And you have to say, well, where else can I get my iron from? So nuts have iron in them. Whole grain cereals have iron in them. Spinach has iron in it. There's a lot of other places to get iron from than besides red meat.
And would you say nuts, almonds? They say that almonds are very good.
Almonds are very good.
Yeah.
Oh, almonds are great. I usually snack on almonds.
Right. So do I.
Almonds are great, and they're good for energy.
Right.
Almonds are very, very good. And sugarless, we spoke about this again last week. Sugarless chewing gum is great, again. Why? Because it generates saliva in your mouth. And you want to have as much fiber-rich fruits and vegetables as you can. Why is that good for oral health? Again, because it stimulates a lot of the saliva flow. Because that's going to be one of the best defenses against cavities that you can have.
Well, Dr. Rosemary, you did it. This was a lot of stuff, and we did it. The show is now over, and we sure appreciated your being here, Dr. Rosemary, in the afternoon. The phone number to call is 954-489-1345. That's 954-489-1345. We'll talk to you next week.
Thank you.
Thanks, Rosemary. Bye.
Bye.